I think in the ESMO meeting, there's another trial that I think that caught my interest is the TALENTop study. And the TALENTop study basically is also a study run in China. Those patients with a borderline or inoperable HCC to start with, but with the absence of the extrahepatic diseases, and then they receive the Atezolizumab and Bevacizumab. So afterwards, if the patient demonstrated a partial response or stable disease, and then they randomize those patients to continuation of the Atezolizumab and Bevacizumab, and the experimental arm is to surgery after if there's a resectable diseases. So and then followed by some 1 year total adjuvant Atezolizumab and Bevacizumab. So basically, it's a testing a concept that for those patients with partial response SD and operable cases, whether they benefit from surgery on top of the Atezolizumab and Bevacizumab. So from the readout, the time the kind of treatment failure or recurrence is that there have been improvement favoring the surgical arm. Of course, I think we need to wait for longer readout and also some of readout from the overall survival. But overall, this suggested that perhaps we need some more MDT or patient-centered approach according to the response achieved from the immunotherapy. For those patients who really have good response, instead of continuation of the Atezolizumab and Bevacizumab till PD, we may offer some of them to surgery, and they do have some benefit from the surgical treatment. So I would say this is a very important study. Of course, in the study, they do observe 20+% of a grade 3/4 treatment-related AE after the surgery. So I think we need to look in more details what are those toxicity, and before we really adopt these practices. But definitely, it points a very to an important concept that we need some more response-adapted surgical approach for these type of more advanced HCC.